Hi, everyone. Today we have Freya, a licensed and qualified osteopathic practitioner who specializes in osteoarthritis, and she practices in Little Buckinghamshire Clinic, based in England. Welcome, Freya, to our podcast, Dotiv the podcast. We're excited to speak to you today.
Excited to be here. Thank you.
Nice. Well, welcome, Freya. And as we are right in the winter season with the temperature dropping, I don't know about you all, but I feel more my joints. So I don't know if I'm developing early signs of arthritis but maybe not. I don't know. But I did some research. I don't seem to be alone. It looks like it's a common problem, but I think that there's different layers to what arthritis is. And so I think we'll be covering this during our episode today. And so just there's around 10 million people suffering from arthritis in the UK, so around 15%, which is quite a big number. And so to start off, maybe we could dive deep on what arthritis is.
Yeah, definitely. So when people say they've got arthritis, often it's just osteoarthritis, which is not an autoimmune condition like things like rheumatoid arthritis or lesser known ones like psoriatic arthritis. Osteoarthritis is more like the wear and tear kind of arthritis. So most people will tend to get a little bit at some point, but there are things you can do to maybe prevent and to manage. Rheumatoid arthritis is more under the autoimmune umbrella. Affects the smaller joints first, typically, so hands, feet, neck, and it comes with inflammatory episodes. So although arthritis literally means joint inflammation, some are more inflammatory than others.
Right. And is it like something that people develop with time, with age, or is it something that people just it's like genetic, and so after a certain age, because the genetics kick in?
Yeah, so I think all of these have some sort of genetic element, but there tends to be a trigger. It seems like there's got to be sort of the right combination of factors involved before it happens. So rheumatoid arthritis will typically affect you sort of around, onset might be around late 20s, 30s, doesn't often start before 50s, and sometimes it seems to follow some sort of traumatic event, whether that's emotional or physical illness, anything like that. But yeah, it seems like it is sort of perfect storm for that onset.
What I described with, the winter, etc., me feeling a bit more my joints, is that like a typical sign, or is it just a thing?
Yeah, so early stage can be quite sort of generic, just sort of general achiness. With conditions that are more inflammatory, like rheumatoid arthritis, it's worse after prolonged rest. So first thing in the morning might be particularly bad, but also aggravated by excessive exercise. So there is that fine line of sort of managing it. But sometimes it comes with more sort of general malaise and things like that as well. So when your body's fighting inflammation, you do get more sort of general unwellness kind of feelings, but again, not in every case.
Right. I'm just curious, like, because you were saying that people who exercise also experience this, right? And it's aggravated by that. How can someone tell the difference between like their soreness and arthritis?
Can be difficult. I would say if it was sort of your DOMS, your delayed onset muscle soreness, then you'd have that tenderness in the muscles. If it was more of an arthritic kind of pain, it would probably happen sort of once you've rested, it'll kick back in. So that might be later on that day, might be the next morning. Again, could be the same with DOMS, but it wouldn't be sort of characterized by that same kind of muscle tenderness. And you might find that there's more of a kind of heat to the area if it's one that's quite close to the skin.
And any link with regards to winter, the fact that we might feel our joints a bit more during winter, is that even a thing?
Yeah, I mean, anecdotally, you hear it a lot, and that would go for osteoarthritis as well. I'm not sure about the research. I don't think I've come across anything that particularly gives you those seasonal patterns. But for all of these conditions, they like a certain amount of movement. So when it's cold and dark and wet, you're probably doing that outside. Maybe that's where the link comes from.
So inflammation, so I hear that inflammation is linked to arthritis, right? So is there a link between the fact that the temperatures are dropping, or the fact that we are moving less, that will cause inflammation?
Probably not directly. If you were moving less, then yeah, the rheumatoid arthritis isn't going to like that. But reduced temperatures, I mean, if anything, if you had an inflammatory problem, you might want to put ice on it to cool it down, make it a bit more comfortable. I mean, the inflammation is there for a reason. So sometimes, I mean, speak to your osteopath. But yeah, it can be soothing to put ice or a cold compress on something inflamed. So yeah, it kind of goes both ways there, doesn't it?
Interesting.
It's always tricky because I find like at different points, you get different messaging, because sometimes they say if there's inflammation, you put ice, but then sometimes there's no inflammation, but there's pain, right? So they put heat on it. So how do you know the difference? Like, of course, you can't just self-diagnose, but is there like a rule of thumb we should all know and follow?
Yeah, it's a bit of a tricky one. Generally, I'd say if in doubt, use something cool, because regardless of what's going on, there's probably some degree of inflammation if there's pain, whether it's an inflammatory condition or not. Heat is really just good for muscles. And even then, if there's a muscle problem, if it's like a tear, micro tear, there's probably going to be inflammation there as well.
Yeah.
So you can't go too far wrong with ice, or rather a cool compress. But in any case, you don't want to do it for too long. So generally, I would say 5 minutes per hour. If you're doing it enough that it's numbing it, it's probably going to hurt more when the feeling comes back.
Oh, wow. Right. Okay. So this is good information, because I think I've definitely done that in the past, where it's like, no, you're like, oh, I think this is a good thing.
Definitely. You hear about that.
Yeah. Typical amateur here. So, right. So I guess if people who have arthritis, I mean, I guess to tell the difference between, to pull it back to arthritis, right? And not soreness. So if there's rheumatoid arthritis, and then there's also osteoarthritis that you were mentioning earlier. So between the two, are they different in symptoms as well?
Yeah, so there are definitely some similarities. The joints affected can be a bit of a giveaway. So like I said, the small joints are generally affected first in rheumatoid arthritis. So that'd be the joints of the hands, feet, neck. Whereas osteoarthritis, we probably hear more about knees and hips. But that said, often people will say that, oh, my thumb's a little bit crunchy, a little bit sore, and that's just a little bit of arthritis there. But smaller joints might even be a little bit easier to manage in osteoarthritis. So silver linings. But in terms of symptoms, to be honest, they're both probably a little bit worse after rest, but for inflammatory conditions, it does take longer to get going in the morning. So when we're trying to screen between rheumatoid or osteoarthritis, we'd want to know how long it takes for symptoms to ease up in the morning. If it's more than half an hour, then we're definitely thinking more inflammatory. If it's just sort of stretch, a little bit of movement, and by the time you've got to the bathroom, you're fine, then probably less of an inflammatory thing.
Yeah, and so what would be typical treatments for those?
So for osteoarthritis, I mean, to explain the treatment, it's probably easiest to explain the actual pathology. So osteoarthritis is a condition of the cartilage. So any joint that's got cartilage could get osteoarthritis. Basically, cartilage doesn't have a great blood supply. It's kind of like a sponge. So you need to be squashing it and unsquashing it to let the nutrients flow in and the waste flow out. So if you're not going through the entire range of that joint, there'll be some bits of cartilage that are always squashed and some that are always released. So they're not getting that same kind of cycle of nutrients and waste. When that starts to happen, the body might try and protect itself. So you might find that might not find, might just happen without you realizing that your joints are being held in such a way. So for the hip, you often lose extension. So that's bringing your leg back. But the body likes to protect itself. So you might actually just start leaning forwards, still getting that movement, but it's not coming from that joint in the same way. And then you only realize when someone says, oh, you're looking really, really stooped. And you think, oh yeah, no, I can't move my hip like that. So the muscles at that point are starting to play a role as well. So when someone comes in, say using hip arthritis as an example again, if someone comes in looking for treatment for that, it would be a case of getting that joint moving first and foremost, which will mean releasing those muscles that are trying to protect it and sort of just working that movement back in, showing the body that it can do it and it's not too painful. And then really important would be the exercises after as well. We've only got a fraction of the week to see you in clinic. But anything that you can do during the day, during the week, that's all going to make such a massive difference.
Just since you're talking about like treating it, right, and how to fix it, I guess a question I have before we, I guess, to utilize that information is, are there movements or any type of activities that it can actually cause that to be triggered, like excessive movements? Because I know from my experience or like of reading, like for example, a sport like CrossFit, you know, because it's high intensity and there's certain types of movement that are potentially not something that people would do on a daily basis, and that I've been told can cause in the long term arthritis, or like severe inflammation, and you don't know the impact until you're aging. Is there something like that you can speak on?
Yeah, so it's all kind of specific stuff. Like I wouldn't say CrossFit as a whole is going to give you arthritis, although I do see quite a few CrossFit injuries. But they say that it's misuse or overuse that would lead to osteoarthritis. So if you had sort of a particularly, I don't want to say bad form, because I mean, particularly things like squatting, there's not really one right form for everyone. But if you were using your joint in such a way that it's particularly demanding on the joint as a whole, or it's not going through the whole range and it's just sort of repeatedly doing the same thing in one spot of it, that's the sort of thing I'd be worried about. But interestingly, again, it's moderation. So I saw a stat earlier this week, and I didn't save it, saying if you looked at sedentary people, sort of your average runner and your ultra marathoner, it would be the regular runner who has the lowest incidence of knee osteoarthritis. So that kind of underusing or overusing, that's the sort of thing I'd be looking for.
That's a good point, and kind of gives you context to how our body works as well, right?
Yeah, definitely. We're not a car. We're not going to break down. It's not the same kind of thing. We are adaptable. So I think other studies of, again, using runners as an example, found that the discs in the lower back are kind of healthiest in those average runners again. You respond to the demand that's put on your body.
Yeah, basically everything in moderation, isn't it?
Absolutely.
And to bring in so we spoken about osteoarthritis for the treatments. What about rheumatoid RA?
Yeah.
But why I'm saying this is that when I prepared for this episode, one thing that we found is that a study where it showed how there's potential ethnic disparities with regards to prevalence to RA. I'm not going to try to say it. And it looks like, so one of the conclusion is that there's a greater prevalence for minority groups versus white patients in the US. So this was done in the US. Potentially minority ethnic groups are potentially more prevalent to this. Have you observed anything in your practice that would be a testament to this?
Yeah, so annoyingly, 99% of my patients are white. So trying to spot the patterns myself is pretty much impossible. Right. What I would say is, when we're talking about ethnic differences as well, is that sometimes there are sort of ethnic predispositions to conditions, and we know that RA has a strong genetic link, so potentially that's a factor there. I suppose as well, maybe we're thinking things like, what sort of different lifestyles are we talking about? Is the average job more demanding? Is there more likely for that physical or emotional trauma that might set it off in the first place? So yeah, so many different variables in it. I suppose we're lucky here that at least the access to healthcare is there for everyone. Definitely. At least the medication side. But in terms of management, again, it's finding that fine line between doing too much and not doing enough. So the same applies to treatment and exercise, as well as just what you're doing day to day. So although I wouldn't say that osteopathy can cure RA in any way, we can help manage the symptoms alongside the necessary drugs, medications. So it would be a case, again, thinking similarly to osteoarthritis. What are the muscles doing? What sort of compensation is there? You can look further afield as well, like, is the neck involved, and is that made worse by the upper back being particularly stiff, like demanding more of the neck that's already irritated because the upper back's not moving enough, things like that. So that's kind of the osteopathic approach. Look at the body as a whole, but also make sure that the local area is working well in terms of the joints and the muscles. With things like the neck, you'd probably be thinking more about instability in the later stages. So the small joints just get a little bit more overloaded, and the neck muscles are fine for what they're meant to do, but when you start putting more of a load on them, they do struggle. So thinking longer term about strengthening, that kind of thing as well.
That makes sense. And would you say that these different type of arthritis are preventable?
Probably not for RA, just because of the factors in it. I guess in an ideal world, maybe OA would be preventable. If you can keep yourself in that range of moving enough, moving through the whole joint, not doing anything badly. I hate to put those labels on it. But yeah, I mean, if we were all running like 5K every other day or something, yeah, maybe we'd all have great knees, but obviously everyone's different. That said, there are things that you can do to reduce the impact or potentially reduce the risk of developing it in the first place. Thinking about whole body health, if you're eating well, moving well, what do they say? Food, sleep, stress, and exercise. If you've got those 4 under control, then you're setting yourself up for the best.
That's such a great summary. Yeah.
Yeah.
I mean, it's all about like living that balanced life, be it even as we were talking earlier, the average runner versus, the marathon runner versus the person who's not active at all. So if you do get in some exercise, would you say daily or every other day?
Yeah, I quite like the 10,000 steps. I know it's an arbitrary number, but if you're doing, I mean, if it's just a case of you're going to walk to the shop instead of drive it, and then the next day you do your exercise and do a run, or the next day you swim, little and often.
Yeah, that's a good indicator and reminder actually of what we should be doing. Not should be, but what is, I guess, ideal.
Yeah, it's a good starting point.
Agreed. So as our normal close off that we do, we have a rapid fire round of questions. So our first question is, what is the worst health advice you've ever received in your life?
Well, having had a baby in the last 18 months has been some pretty awful advice there.
Oh, really? Tell us.
Oh, honestly, I won't even. The 6-week check was an absolute disaster. I'm not even going to go there. Maybe more topical would be in regards to back pain. Just rest it. No, don't just rest it.
Right.
Give it a little bit of rest, but again, the more you can move it within a reasonable amount, the better you're going to be. There's a reason that GPs don't prescribe bed rest now. So if you've got back pain, move it. If you've got arthritis, move it. Just don't go doing the ultra marathons.
Yeah, because I was like, move it, but how?
10,000 steps exactly.
Exactly. And our next question is, if you had one habit to promote, what would it be?
Oh, that's a tough one. Can I say movement again? I'm a bit of a one-track record today.
Movement or hydration, and there's the two things that could be of use.
Yeah, no, I'd say movement's good. You can't go too far wrong with you. 10,000 exactly steps. But yeah, a good variety of stuff as well. If you were doing like a swim a week and a 5K a week, and then just sort of walking about in the meantime, then yeah, that'd probably be ideal, to be honest. And not too unrealistic either, she says, doing neither of these things.
And our final question is, if you were to put a song or a soundtrack to your life, what would it be?
I was thinking about this one. This is impossible. It got me thinking about my 2020 Wrapped, but we don't want to go there. 2021 Wrapped. It's 2021. Yeah, no, we don't want to go there because that wasn't a great soundtrack. But I would say every year apart from this year, the one artist that keeps coming back is Banks. So any of her stuff, play that and it'll probably suit me at any time.
Nice.
Okay, great. That's a good answer. Well, thank you so much, Freya, for your time and your
Thank you.
insights and for being on our show.
No worries. Thank you for having me.